My name is Latrice Martin. I am a certified nurse midwife, a family nurse practitioner, and I am a doctor-prepared nurse practitioner, so DNP. There are several Black maternal health disparities that is affecting our country today. One is infant mortality. The African American population infant mortality rate is 11.9% compared to white Americans, which is only 5.3%. Our preterm birth rate for African Americans is 12.9% compared to white Americans, which is 9.1%. Low birth weight, African Americans are at 12.8% and white Americans are at 6.9%. Maternal mortality rates for Black, American Indian, Alaska Native women are at 3 times more likely to die from pregnancy-related causes up to 1 year after birth than white women. This spans income, education, and this disparity does increase with age. So in addition to chronic illness, pregnancy complications, and other known risk factors for pregnancy-related mortality and severe morbidity are advanced maternal age, no prenatal care, lower levels of educational attainment, and low socioeconomic status. These women face barriers such as cost, transportation, childcare, psychological distress, communication with provider, and knowledge. So the question I get is, what can families and pregnant individuals do to prevent these outcomes? As families, we can strive towards doing reproductive life planning, and that includes preconception care to address those comorbidities such as obesity, at-risk drinking, smoking, diabetes, and frequent mental distress. Also, planning pregnancy. Unintended pregnancies have been linked to multiple adverse perinatal outcomes and significant racial ethnic disparities. Another is postpartum or interconception care. It is important for monitoring the health of women with chronic illnesses, because women that had preeclampsia or hypertension in pregnancy are increased risk for developing cardiovascular disease later. As well as if a woman had gestational diabetes in pregnancy, they're 7 times more likely to develop diabetes later. So low postpartum attendance also can equal no prenatal care or late entry to care. So what can providers or health systems do? Most morbidity and mortality events are preventable. We as providers need to provide equal care to all. Studies show that delay of prenatal care initiation has been associated with endorsements of experiences of racism. We as providers need to ensure we prevent inappropriate or delay in diagnosis and treatment. We as providers need to help prevent communication failures and ensure policies and procedures are in place and are followed. We need to educate other clinicians and staff about racial and ethnic disparities in maternal outcomes, the importance of shared decision-making, cultural competency, implicit biases are all important steps to address disparities in care. So I know I just shared a lot of information with you and it can be overwhelming, but just know that we are all in this together to work to decrease these disparities, and please reach out to your community organizations, talk to your providers, let them know your concerns so that we can all work on decreasing these disparities.